Hi everyone, habari zenu. Today we are going to answer a question that was posted about 2 weeks ago, and the question was whether repeated exposure to anesthesia can cause long-term memory loss. Ilikuwa kuna mtu aliuliza swali kuhusu kupotezwa fahamu. Kama umpotezwa fahamu mara kadhaa, yani ufanya operesheni kadhaa, hal hiyo yafanya uwe na sahau nyingi? Sasa leo Dr. Sameera Ramzan ambaye ni mwanafunzi wa kupoteza fahamu atatueleza.
Hello everyone, my name is Dr. Sameera Ramzan, a senior resident in Anesthesiology. This is in regards to a question that was posed earlier about anesthesia and memory loss. Well, one of the major components of anesthesia is what we call amnesia. So what is amnesia? Amnesia basically means memory loss to pain or distress. For example, let's say you have a broken arm and you are put on the stretcher and you're actually wheeled to theater. So from the stretcher, we usually put the patient on the theater table before the surgeon actually starts to work on your arm and fix it. So let's say, for example, during that time of transfer from the stretcher to the theater table, it was a bit traumatizing. Because of those little movements, you start feeling pain and you're basically in distress. So what we do while we make you sleep is we give you medication, what we call general anesthesia. So what our drugs do actually, once we instill the drugs into the IV line, it goes and acts to the brain. So in the brain, it actually inhibits part of your memory. So let's say, for example, you wake up, you'd barely remember anything about that pain you experienced during the transfer to the theater table. So that is what we call amnesia. Most of the time, what is expected is that once the drugs wear off, the memory loss actually wears off again. But in a few patients, or a percentage of our population, basically have a persistent memory loss. Ideally, the memory loss should not linger long. For some people, it might wear off in a few hours once the drugs have actually gotten cleared from your body or your system. For others, it might persist for days, weeks, or even months. And basically, where we get our figures are from studies. So there's a guy called Osler who actually conducted a study in regards to memory loss and anesthesia. And he actually found out that a larger chunk of patients who actually experienced memory loss, that for some patients actually took as long as 4 years, were actually the middle-aged and the elderly. These are the guys that can actually have cognitive dysfunction for as long as sometimes days or months. But again, this is supposed to actually wear off. One of the ways to actually get back your memory is to do loads of exercises to stay hydrated. Some talk about acupuncture. Some talk about loads and loads of exercises. This again partly is associated with anesthetic exposure. What I mean is that the more surgeries you have equates to more anesthetic exposure. So the more anesthetic exposure, the higher chances of you actually having memory loss. I hope that answers the question.
Yes, Dr. Sameera, I believe you've answered the question very well. Thank you very much. And if anyone has any further question, please post them in the comment section and we'll get back to you as soon as possible. Thank you for watching. Stay tuned and stay healthy.